Hi there, podcast and public radio fans. Heath Drusen here, host and creator of the Extremely American podcast. I'm working on season 3, which is an urgent story about neo-Nazi terrorists and how they helped build a modern white supremacist movement, even from prison. Some of their ideas have even made it to today's White House. It's both a gripping true crime story and a timely warning about threats to our democracy. And this time, my investigative reporting is funded by you. To support the project, please make a tax-deductible contribution at extremelyamerican.org. That's extremelyamerican.org. And thanks.
From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Jim Gaudette. This is Idaho Matters. By the end of this year, more than 55,000 people will die from colorectal cancer. More than 158,000 will be diagnosed with the disease. And once you're diagnosed, 35% of people will be dead within 5 years. Those are very scary numbers. But cases in older adults are actually dropping. That's the good news. But for men under the age of 50, it's now the leading cause of cancer death. And for women under 50, it's the second leading cause of cancer death. So, why are younger people getting colorectal cancer? That's the question St. Luke's Health System is trying to answer with a study. Tammy Elsinger is the Senior Manager, Oncology Clinical Research at the St. Luke's Cancer Institute, and she's here to tell us about it. Tammy, thanks for being here today.
Thank you so much for having me.
Okay, tell me about these numbers. I was looking these up over the weekend. Cases are rising in people under 50?
Yes, absolutely. Since the 90s, the incidence of colon cancer in people under the age of 50 has about doubled. And we're not seeing that decrease. We're seeing it grow.
That is really scary. Is that a trend we're seeing in Idaho?
We are seeing it in Idaho, and in fact, it's a global issue. It's not unique to the United States.
Okay. And before we get into the study, do we have any idea why this is happening? I mean, obviously you're trying to find out with the study, but are any clues?
We have a lot of suspicions. Obviously, we lean towards the given things that we know can impact cancer: diet, exercise, environment, all of those normal things. But given the way that it's increasing globally, that makes us wonder if there is maybe more. And one of the things that we're looking at specifically with this study is the gut microbiome, which is, your internal parts. And what kind of insults have we had for maybe much of our lives that are causing that increase in cancer?
Oh, that's interesting. Okay, so tell us about the study with St. Luke's and the Dana-Farber Cancer Institute.
Absolutely. So the study is part of the Optimistic Project, which is a program out of the UK, and Dana-Farber is one of the co-authors on that study. And the part that we are looking at specifically is young onset, obviously. So what we are doing is asking people under the age of 50 who have been diagnosed with cancer to give us a little bit of insight into their lives. So they provide stool and blood samples as well as tissue samples. And then they fill out a lot of questionnaires about their lifestyle, their diet, their environment, their hobbies, their family, what their professions are, all kinds of questions like that. So we can gather this information. We send it all to Dana-Farber, and they evaluate the specimens as well as the questionnaires and try to find trends.
Wow. Okay, that's a lot that you're gathering up. How long has this study been going on?
We enrolled our first patient in June of 2021, so about 5 years.
Wow. Okay, why is it important to have Idahoans in this kind of study? Could where you live make a difference maybe in your risk factors?
Absolutely. We know that the environmental risks, the eating habits, maybe even career paths are different for people, say, in Fruitland, Idaho, than they are in New York City. And we want to make sure that when we are pulling together the facts and trying to understand what is going on, that we're having a global representation. So we want to make sure that our rural patients in Idaho, as well as our metro patients, are being represented in those findings.
Okay, you mentioned it's been going on since 2021. Obviously, it's not done, but have you found out anything so far from the study? Have there been any indicators?
No, not specifically from our study. We do know that there are some studies that are reporting the some different insults, we'll call them, in the gut microbiome that we're finding frequently in patients who are participating in different studies. So we think maybe those are lending to this increase, and those findings suggest, much like a lot of cancer, that this isn't something that you did last week or last month. This is something that maybe you had things you ate as a child, and then when you're in your 30s and 40s, it starts disrupting your gut biome. And so we're gathering information, but we don't have enough at this point to say, yes, this is what it is, and this is how we need to change it.
I got to ask, what is an insult to my gut biome?
It could be it could be something you ate as a child. It could be pesticides in foods. It could be something as benign as your parents' career. Maybe they were around a lot of chemicals when they were pregnant, or those kinds of things. So they're just things that live in your body and disrupt the natural process of your gut.
Wow. We're speaking with Tammy Elsinger, Senior Manager, Oncology Clinical Research at the St. Luke's Cancer Institute, about a study looking at colorectal cancer in people under 50 years old. And I want to pick your brain just for a minute, since you are part of the Cancer Institute. I was kind of amazed. I think we think of colorectal cancer, I think at least I did, as for people over 50. And now we're hearing it so much about people under 50. And these are a lot of numbers, but these are real people, right? These are people, younger people who are getting this very often deadly disease.
You're exactly right. And it's heartbreaking, because we all of us in oncology, we're used to colon cancer being an old person's disease, but we have patients who are in their 20s. Our youngest patient enrolled on the trial was 21.
Wow.
And the challenge with this population is they don't recognize the symptoms as colon cancer, because the last thing you think is, I have colon cancer. So oftentimes by the time they come to us, their disease is very advanced. Another challenge is when they go to the doctor, the last thing their physicians are thinking about is colon cancer. So they maybe don't test it. And getting insurance to cover that is a challenge. So these young people are coming with very advanced disease.
Wow. And the more advanced it is, the harder it is to fix, right?
Exactly.
So what can we do? You mentioned symptoms. What are the symptoms of this kind of cancer?
Things you can watch for would be changes in your bowel habits, constipation, diarrhea, blood in your stool. Obviously, if you see blood in your stool, don't assume it's something else. Go to the doctor. Persistent abdominal pain, unexplained weight loss, anything that doesn't feel right for your body. It's worth looking. It's better to be safe and asked than wish you had later.
And what about testing? I think one of the hang-ups that people have about trying to find out if they have this sort of disease is the testing, because some of it is not pleasant. What kind of tests can be done? What kind of tests are done? And then you mentioned the guidelines. I want to talk about that too, but let's start with tests.
Perfect. The gold standard, of course, is colonoscopy, and that is the age of colonoscopy is 45. So you want to start doing that, definitely, unless you have a family history and then it's earlier. But we can also do tests through stool and blood now, which is great. They aren't quite to the point of a colonoscopy yet, but they are still very useful tools. And Dr. Zuckerman, our GI expert at the Cancer Institute, always says the best test is the one you do. So whatever you need to do, start somewhere.
That's good. I like that. Well, I must say that, colonoscopies come with a bit of a stigma, for lack of a better word. They can be scary. They can be, unpleasant sounding.
You're exactly right. A lot of people hesitate to get them because the prep is difficult at best, and you have to be, you have to be sedated. You have to go through a lot for a colonoscopy, but it's a lot less bad than missing cancer.
I like that.
I can assure you that the cancer care is maybe a little worse than that colonoscopy. So
I would think so. Okay, you mentioned 45. What about the age guidelines? And are they changing? Should they change with this new information about the rates that are going up with people under 50?
Yes, we would like for them to change, but we have to have data to make that change. They were 50, and so they've decreased them to 45, which is wonderful. And obviously that's for screening, right? And that's important. You need to do your screening because early diagnosis is your best chance at surviving a cancer. But I want to emphasize that if there's something going on, advocate for that testing. Even if you're not 45, you have to advocate for yourself and really push forward to find out what's going on. And maybe that's a colonoscopy, maybe it's some other test, but it's important to do it.
I think I read that the Brian Olson Memorial Golf Classic is helping to pay for the study. Is that right?
They are. The Brian Olson team helps us purchase stool kits for this study. The stool kits are fairly expensive, and this study is completely unfunded. So without organizations like the Brian Olson Foundation and Betty Heiss for Cancer Research, we would not be able to do the study. We just wouldn't have the funding. So their support is crucial in finding these answers and including Idahoans.
So it's been going on since 2021. How long will the study go?
Until we find answers.
Yeah. Wow.
Yeah, we don't have an end date. We just keep collecting data.
Are you hopeful that the study might give you some answers?
I feel confident that the study will give us answers. The Dana-Farber team is phenomenal in research, and they are committed to this. Dr. Eng is the PI or the principal investigator at Dana-Farber, and she is a GI expert, very, very focused on finding out what is behind this increase.
Wow. And are you finding volunteers? Are people willing to go through all of what you said that the study involves to try and help find answers?
Absolutely. It's very interesting to work with these patients because they recognize that this is not what they perceived as normal, right? They never dreamed that at this age in their life they would be facing colon cancer. So they're altruistic commitment to finding answers and helping other people is just inspiring and phenomenal. We rarely have someone turn us down when we offer participation in the trial.
Wow.
And it's not easy for them.
Well,
It's a lot of
yeah, and they've already got a lot on their plate if they've been diagnosed.
Exactly.
Yeah. Wow. Well, good luck with the study. Maybe we can check in down the road and find out how things are going.
Thank you. We would love that. We'd love to update everyone.
We've been speaking with Tammy Elsinger, Senior Manager, Oncology Clinical Research at the St. Luke's Cancer Institute, about a study looking at colorectal cancer in people under the age of 50.
Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. And you can also listen to Boise State Public Radio podcasts, including Idaho Matters, on YouTube.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious, because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.